Now we are going to discuss about positioning patient for surgery. That means what are the position we have to maintain for surgery. First we will see the definition, then purpose, then I will explain 10 position for the surgery. We will discuss today only 10 position. First we will see the definition. Providing specific position for the patient undergoing surgery which promote best visualization and accessibility to operative site and promote safety and comfort. That means providing specific position for the patient undergoing surgery. In that time, we have to provide specific position according to the surgery. We have to provide. Why means which promote best visualization. That means we can see the correct visual, means we can see correctly, and accessibility to operate site is very easyable to access and promote safety and comfort. It promote safety, comfort to the patient as well as doctor. Next, we will say the purpose. First one, to provide necessary accessibility and expose for the site to be operated. So it's given the good expose to the site of the operation area. And second, to facilitate administration of anesthesia and efficient monitoring. So it's very helpful for the anesthesia team and it helpful for efficient monitoring also. Third, to ensure safety for the patient and prevent injury. If we are providing proper position, we can prevent from injury. Then to promote normal circulation and respiratory function. If you are keeping proper position for surgery, we can maintain good circulation and respiratory function also. Then provide correct skeletal alignment. That means we can maintain proper skeletal position. Then prevent under pressure on muscle, nerve, skin, over bony prominence and eyes. So we can prevent from ulcer pressure on which area means muscles, nerve, skin and bony prominence and eyes. So we can prevent the pressure in this particular parts. Then we will see what are the articles is needed for this procedure. First, we need headrest, arm board, sandbag, pillow, Macintosh and stirrups and drapes. So these articles is additional for the positioning of the patient. So first we will see the supine position. Supine position means it's like a flat position, like a sleeping position. So position of the patient flat on the back. Position one arm at the side of the table with hand placed palm down. Position of the other arm carefully on the arm board to facilitate infusion of the fluid and medication. Position head and leg straight. Check the leg are uncrossed. That means leg should not uncrossed. It should be straight position only. Apply well padded safety stirrups 2 inches above the knee. Then for surgery, on face or neck, stabilize head on headrest. That means under the head, we have to give some support. We have to take care of the pressure point. Pressure point means head and buttocks, knee joint and ankle joint, elbow, that everything we have to take. So in that supine position, under the patient head, we have to give some support. Under the knee, under the ankle, we have to give some sandbag or pillow to prevent the pressure. Then what type of surgeries we are doing in supine position? First one is abdominal surgery. Any type of surgery, for example, appendectomy, hernioplasty, hernia repair, abdominal hysterectomy. If any type of surgery means abdominal surgery, we can use the supine position. And second, thoracic operation. Thoracic operation means cardiac surgery, open heart surgery. Then abdominal thoracic operation, that means lower part of the body, upper and lower extremities. If they are doing surgery means mostly we can provide the supine position. Next one is prone position. Prone position just opposite the supine position, that means a reverse position. So what type of surgeries we are doing in this procedure means in this position? Thoracic and lumbar procedure in spinal cord. Any type of surgeries means we can use the prone position. Laminectomy. Laminectomy means it's a one type of the neurosurgery. In the laminectomy means lumbar side, spinal cord side, they are doing surgery. Pressure point means forehead, eyes, chest, abdomen, elbow, knees, breast, and genitalia. In this part, we have to give more concentration. This is the prone position. Next one is lateral position. So lateral position, we can use right lateral or left lateral. That means position the patient on the non-operative side with the air pillows. We have to provide the support in the side between the knees and under the head. So according to the surgery, according to the surgeon comfort, we have to provide the support. So mainly this type of position we are using renal surgery, that means kidney surgery. So what are the pressure points? That means head, ears, shoulder, elbow, hip and knee. In this place we have to provide some support. So third one is lateral position. Mostly they are using renal surgeries. Fourth one is breast and axilla position. So this position mainly if any surgery, breast and axilla part means we can provide breast and axilla position is nothing but supine position, but only extended hands because we are doing surgery, axilla or breast. In that any surgery is there means we can provide this position, breast and axilla position. So mainly which surgery means any cancer, breast cancer or in axilla, any lymph nodes formation, they have to remove it, we can use that position. Here the pressure point, heels, behind knees, arms at the point of the extension from the table. So this is the breast and axilla position, fourth one. Then fifth one, next position is lateral position with kidney bridge. That means this position using for the operation on kidney, chest and hip surgery. So operation on kidney means here mainly this position they are using kidney transplantation. If patient they are doing any transplantation of the kidney, that time they are using this procedure, or any removal of the kidney or any stone removal from the kidney, that time also they are using this procedure. And chest and hip, if patient is having any chest related problem or any surgery, that time we can use left position with kidney bridge, or any hip ortho surgery, that time we can use this position. Here the pressure point, heels between the legs, under the thighs and retainer, upper and lower arms. So in that areas we have to provide pillows or air cushions. So fifth one is lateral position with kidney bridge. And next one is Tendelin-Burke position. This position, place the patient flat on back, lower the foot, end of the table, so that patient knee are flexed slightly. So it's just like a supine position, but here what will happen? Head is down, leg is up. This is the Tendelbaum position. Which operation we are doing in this position means operation on lower abdomen and pelvic surgeries. If patient is having any lower abdominal surgery or any pelvic surgery means we can provide this position. So what are the pressure points? Again, occiput, shoulder, elbow and nails. Next one is sitting cranial position. Sitting cranial means in this position, if patient is having any craniotomy, they want to do any tumor excision, that time they are making this position, sitting cranial position, used for cerebellar operation, high cervical laminectomy, because this the cervical part present in this area, In that, any laminectomy they are doing, that means disc removal in this cervical part, that time they are doing laminectomy. They are making the patient sitting position. So important here, the head is stabilized with cranial support. Arms are secured to body support attached to the operation table. The degree of the flexion of the neck is variable. Then pressure point, which area means heels, behind the knees, buttocks and arms. So this is the pressure points. Next we are going to see rose position. The rose position, other name is neck position. Here this position mainly using for the tonsillectomy surgery. Tonsillectomy surgery means removal of the tonsil, and thyroidectomy surgery. Thyroidectomy means removal of the thyroid gland either partially or completely. And next one is tracheostomy, opening of the trachea. In that surgery, they are using rose position. Place the patient flat on the back. What they have to do means neck extend. In between the head and shoulder, they have to put one pillow for the support. Then only the neck is extended. So this is the rose position or neck position. The mainly which surgery means thyroidectomy, tonsillectomy, tracheostomy. In that surgery, they are using this position. So what are the pressure points here? Occiput, shoulder, elbow, buttocks and heels. In this place, we have to take that. We have to give some support. Prone cranial position. Prone means just reverse of the supine position. Patient had any intracranial pressure increased, or patient had any incident. In that time, what will happen? Surgeon want to remove blood clot, otherwise surgeon want to stop the bleeding inside the brain. So that time they are using this position, mainly craniotomy procedure. Here the pressure point, feet under the straps, arms and the point of the support. So this is the prone cranial position. It's nothing but prone position, but we are focusing only the head, that's the skull part. If surgeon want to do craniotomy procedure, in that time we can use this position. We have to provide support, pressure point, the knees, between the knees and chest, shoulder point. So in that place we have to provide some support. The next one is lithotomy position. Lithotomy position means here supine position. That means the leg is extended. So lower the foot section of the table, attach the stirrups to the table on the either side to the place patient leg. So this is the lithotomy position, supine with flexion knee. Here the position lithotomy. Which surgery means cystoscopy. Cystoscopy means this one type of the urology procedure. Operation on vagina, perineum or rectum. Any reproductive related surgeries means we can use the lithotomy position. So here the pressure point, forearm, buttocks, inner aspects of thighs and occiput. So in this area we have to provide pressure. Means we have to provide some pillows or air cushions or something. So today we discussed position for the surgery. First we discussed the definition, then purpose, articles, then finally 10 position we discussed, what type of surgery they are using, what are the pressure points. Thank you.